Hey folks, welcome to Snowpal Polyglot Software Development Podcast. Our guest today is Dr. Sam Zand. Dr. Zand is a holistic psychiatrist, educator, psychedelic therapy leader, and founder of Anywhere Clinic, offering care across 20 plus states in the US. Dr. Zand, thanks for taking the time to chat today.
Thank you so much for having me. Excited for this
Uh,
conversation.
Me too. And if before we get started, we go into the actual topic. The topic for today, by the way, folks, is what role does AI play in the mental health journey? Now, again, this is very new, the area to me. I've had one conversation with a guest on the podcast here a while ago about mental health in general, but neither of us had any certification or any expertise of any such kind. It's just that the guest wanted to talk about it, and I was like, you know what, I'm more than happy to provide a platform to do that. This is, I want to say, probably the first time we have somebody who's actually a professional from in the space of medicine here, if my memory serves me right. So, Dr. Zan, before we get started, if you could just give a brief intro about yourself and the work that you do.
Yeah, absolutely. So I'm a holistic psychiatrist. I think the word psychiatry is even a little bit triggering for people because in many ways I like to think we've evolved so much recently and the history of psychiatry has been a little difficult. We've fallen into patterns of overprescribing and overdiagnosing. And so our work has been trying to figure out how can we really help people in their mental and emotional well-being. We have a practice in now over 30 states, Anywhere Clinic, where we train really compassionate professionals to be there for patients in their mental health, whether it's depression, anxiety, insomnia, trauma, heartbreak, grief, loss, whatever it might be. This is our work. We're there helping both through medication, through talk therapy, but now also trying to find other tools and avenues to help people. And so psychedelic therapy is something that we focus in as it pertains to ketamine, which is a legal prescribable substance. We've gotten into AI therapy models that I think have been very helpful for a lot of the population. And so consistently trying to figure out how can we be there for our communities? What are the new tools? What are the boundaries, the guidelines, and how do we help people just find their best selves? Clarity, peace, and happiness.
Awesome. Thank you. There's plenty for me to learn here. So, without further ado, we can just get started. One of the first questions I had was, what is psychedelic therapy?
Yeah, it's actually a very interesting and somewhat controversial modality. Psychedelics, generally, we think of medicines like psilocybin, mushrooms. They're illicit drugs right now, most of them. LSD, MDMA, these are substances that people would think maybe they're substances of abuse. People use them at raves and parties. However, for many, many years in Western medicine, we've understood the healing benefits of these drugs, but they've been off limits because in the 80s there was that war on drugs, 70s, 80s, and they moved all of these psychedelic medicines to what we call Schedule 1, meaning you can't use it in medicine. I, as a doctor, cannot prescribe it. It's in fact illegal to distribute. However, ketamine was a drug that came out 50, 60 years ago for operative reasons at very high doses. It pulls people away from their body so that surgeons can operate without having to use traditional anesthetics like opiates. It's in fact used for children very often in hospitals for surgical reasons. Now, we've in 2019 developed a FDA approval for ketamine for depression. And it's really shifted the way we looked at psychiatry, where before you probably are familiar with Prozac. It's an antidepressant. You take it every day. It's a very passive experience. But we found that these meds aren't really working that well. Instead, the psychedelic journey is about taking a medicine and having an experience with it. The word psychedelic means mind expansion. And so we actually, as psychiatrists, take advantage of that altered state of mind, that altered state of consciousness, and we help the patient therapeutically learn more about themselves, open up subconscious pathways that maybe they hadn't seen before, and really develop new patterns of thinking, behaving, and feeling. The core concept is it makes the mind much more open, flexible. It actually increases neuronal growth and neuronal connections in the brain. These are things we've only really learned in Western medicine in the past 5, 10 years. but psychedelics have been around for centuries and millennia, for ancestral culture and shamans and the doctors of hundreds of years ago were using these in tribes and different cultures, and they still are mostly. In Western medicine now, it's gaining traction because of the legality and indication of ketamine as a primary tool.
This is amazing. This is so highly technical. And I'll be honest with you, I have to listen to what you just said there more than once for me to actually truly understand it and digest it, which is probably going to be true for some of our audience, but it's great. People can pause, go back and listen to it again and watch it to get the complete understanding. And I'm quite excited for the next 30 to 45 minutes, given just that introduction and how little of that I actually understand. So I'm going to ask you some really silly and stupid questions. My apologies upfront for all of them in totality. So let's get into the topic per se, right? We want to talk about what role AI plays in the mental health journey. So let's start there and we can see where the conversation takes us. If you could sort of give us an introduction to mental health in the context of AI, if you will, or maybe even independently so, and then just bring AI into the
Yeah,
mix.
absolutely. So when you're seeing a mental health professional, it's usually for one of two things traditionally. It's for therapy, where we're just talking. Therapy is all about trying to understand our thought patterns, trying to understand why we show up in life in certain circumstances the way we do. And the work is in changing the way we think if it's not serving us, changing the way we behave in order to change the way we feel. Understanding that all these things are connected, that's psychotherapy in a nutshell. The other part of the work is giving people medication to help them. If they're feeling depressed, something maybe brings them up. If they're feeling anxious, something relaxes them. If they can't sleep, there's medications for that. I feel that as a industry, we've shifted too much into the medication because the therapy's hard. It's the patients when they show up, all of them, a lot of them are not motivated to do the therapy work. And as a culture, as a Western medicine society, we've got it accustomed to saying, well, here's a pill to deal with your problem. Now, as we've trying to bring more therapeutic integration into our care, we're kind of limited. Sometimes therapists aren't good. You go to a therapist who is going through their own trauma and their own stress, and they can't show up for the patient as best as possible. Sometimes they're young and they're still training. And I have often patients say, can I get an older therapist? It just feels like this person hasn't really lived life yet for them to be able to help me. And so we have all of these roadblocks in therapy. And what we've learned at our practice is with AI, we can actually use AI as a tool to not replace, more so augment the care that we give. Even if me as a therapist, maybe you said, I lost a loved one and I want to go to see a therapist because this grief is really bothering me. It feels like too long to find my normalcy again. Well, the therapist will sit with you, probably an hour session every week, maybe every 2 weeks, maybe every month. But what happens in between that time? One of the biggest gaps in care is I might work with somebody and they feel some insights, some profound understandings about their life, something that they want to apply, but they don't see me for another month and they forget about everything that they just talked about. AI has provided a tool to serve in between our sessions, and it's just that extra therapeutic guide, more so um, for emotional regulation, for coping mechanisms, for advice and guidance if we're having a hard time. And this really all stemmed from me using it myself and just seeing how we can use it as a therapeutic tool, our clinicians, providers, team members using it themselves, and then creating models that are safe and applicable for the communities around us.
Amazing. I have a number of questions there. Let me start with my first one. Um, you know, let's say I run a startup, like I said, in the suburbs of Washington D.C. I've been building software for years. Uh, we'll come to AI in a second, but the reason I give that context, even if it's sorry a bit repetitive, is we're stressed, say, in our work. And we are, as an engineer, I'm just going to take an example. You're trying to fix a bug, it takes time, you're frustrated, doesn't happen. If you've done it 100 times, then you know how to deal with it. But for people who are getting started, some of this could become stress or stressful because you have a deadline to meet and whatnot. And then you want to in layman's terms, I believe, and correct me if I'm wrong, it affects that person's mental health, and they're looking to go talk to a human to find that help. So going away from a machine that was beginning to give them problems, if you
Hmm.
will, to a human, is there a bit of an irony here? Because now with AI in the mix of things in the mental health journey, am I going from a problem I'm having with the machine in a different way to trying to get a machine to help me as well?
Yeah, that's fascinating. I would add a corollary to that. Many of the problems that we have in society come from interactions with humans, right? And so we're going to
Absolutely.
humans to solve that too. I think it's less about what outlet we're going to and more about how we're utilizing it. Even if you went to a therapist who maybe is very well versed in the work, they've been doing it for decades, we may not be ready. Our mind may not be open to that. They may not connect with us, their style, their approach. And so also anxiety gets in the way sometimes. People say, I have trouble communicating. I've been really introverted and opening up. I feel guarded. It feels difficult. So there's levels of, what's right for each person. For some, going to the computer, going to the AI to help us, it actually feels more sentient, more human, more connected, because the human response isn't always a loving one. It isn't always an empathetic one. Me, I consider myself to be a very good therapist, a good psychiatrist, but sometimes I'm distracted. Sometimes I'm less than my best self. Sometimes the patient I'm seeing triggers me because maybe I learned that they were yelling at our staff and they were threatening lawsuits, and now I have to show up with love and compassion, right? And it's hard. I'm only human. And the AI doesn't have those interferences. And so I think while most of our patients, their genuine feeling is this is strange at first, I'm seeking human connection and this doesn't feel human. What they end up noticing over time is that AI is developed and progressed in such a way that it actually feels sentient, it validates, it comforts, it is able to focus 100% on you, which is what we're supposed to do as doctors and therapists, but it just doesn't always happen that way in real life. And also, I'm very well educated in therapeutic modalities, but I don't know all of them. AI knows all of them. And so it's more educated, it's more capable of not having its own emotional interference because it doesn't have any. And so I think there are pros and cons definitely on both sides.
I think you make some great points there. You start out saying, you're human. Sometimes we have issues with humans, and you go to a human for compassion. When you can do that, why not go to a machine, which is very valid. The thing I want to ask you there is, what if we talk about biases, like humans, we tend to have some prejudice and biases within ourselves. A machine does not, or maybe AI in certain cases might. So if you could just speak a little bit to that. In other words, when you go to a machine versus a human, what are some of the biases that you have to sort of
Yeah.
expect or deal with?
Right. The technical term for this in our industry is called transference. Transference is the feelings that the patient has based on what they've been through in their life that they then transfer onto the provider which they're seeing. I remember young in my career, I was in my early 30s, and I had a gentleman who was 60 something, and he said he looked at me like a father figure. And interestingly, his father was a therapist, and he didn't see the age barrier, he just saw the role. And so his transference was, I'm kind of like a dad to him. That's not good or bad. We just have to understand it. Now, some people have a negative transference of, I don't want to even see a male therapist because I was abused by men and it's hard for me to be around men. Some people have the same transference when we're talking about AI. I've had people who feel very lonely, and when we bring up AI therapy as an option, they get upset because they say, I don't want a computer to make me feel more human, more connected, to help me therapeutically or emotionally. I want a human to do that. And so that's all of what we're bringing to the situation that might interfere. And when it comes to AI, it's usually that obstacle that makes it tough. Now, there's a second part of this is called countertransference. I gave the example of somebody who maybe was threatening lawsuits against our practice, but I'm still seeing him for care. Now, I have a feeling based on my life experiences that I project onto him. And that's what we call countertransference. AI has zero countertransference. And that's, I think, one of the beauties is that it doesn't have its own feelings. It doesn't have its own baggage and drama. Maybe its own glitches is another way of looking at it. But certainly not any emotional baggage that interferes with the ability to be there for its client, for the patient in the scenario therapeutically.
Okay, makes sense. What are some of the things that you are able to do better? Two-part question. The first part is, what are some of the things that you've generally been doing in terms of being able to help people and your patients that you're able to do better, faster, quicker, nicer, all of those Apple type of adjectives using AI? And what are some of the things that you never thought was possible, but then now with AI and Gen AI being available and accessible, those things have sort of started to become possible?
Yeah. Well, I think one of the applications we were really excited about was being able to have immediate emotional regulation. I can speak from a first person perspective. I think we all have a mental health journey. I don't think this is a disease of the sick or the ill. I think it's just something we all go through. And I've dealt with anger in my life, right? I have a father who was a loving father, but also a very angry father. And with that, I've developed certain patterns that didn't serve me. I realized I was snappy at people. I was having a tough time in certain interactions. So, in a traditional therapeutic sense, I would go to a therapist and say, "Hey, doc, I'm dealing with anger. Help me out." I'd see him every week or every month. But now, when I'm angry, I can pick up my phone and I can say, "I am angry and I don't really know why. Can you help me?" And it's that live emotional regulation that I think is so supportive that we've never had before. Because I don't want my patients to call me in an acute emotion, right? It's not the appropriate way for us to interact is to be on call all the time. And who else do we go to? We go to our friends, our family, our loved ones, but sometimes they're going through things and maybe they're not the best to receive what we're going through in that moment. So AI has created this coping skill that I think we've never ever seen before. And the ability to really therapeutically intervene in the moments that we need it. That's what I was most excited about. And now we're just figuring out how do we get everybody there to use this more often. One of the things that I didn't know was coming with AI, and this was when I started to really dive into building GPTs, which is fairly simple. I assume in your audience and demographic, that's like 101s of AI. But for me, this was a huge learning curve to understand, okay, how are we building this GPT and this model to help patients therapeutically? Then I said, well, can't we do this on the system side? We bring in a lot of fresh practitioners out of school, young, still needing a lot of practice. And unfortunately, the only practice we could give them was seeing patients. Part of the training was shadowing. They might sit with me while I see a patient, and then I sit with them while they see a patient. And that's the best we could do so far. Now, through GPT models, we've created a patient case simulation. And I've now programmed dozens of the most common cases that we see in our care. And not only is it an AI model that can speak and emulate, simulate the case, but it's also an educator. So if the provider in training does something that didn't seem appropriate, it can intervene and say, "Hey, let's think of some other ways to approach this. This patient was very anxious, and perhaps what you said was a little minimizing and not validating. Let's work on that." And so now we've developed this beautiful training module that all of our new trainees are using. I didn't know that was possible when we started to learn about AI. And so now I'm so much more excited to see what else is available. And, I need to be a listener of your podcast so I can learn more of this.
Happy, it's amazing that you say that because those examples were perfect and great examples. Let's dig a little bit deeper into each of them. So you mentioned the second one was educator, where the AI is working with those people and sort of telling them, hey, you may have wanted to address this problem slightly differently from how you actually did that. And then the first part of what you said, the way I interpret that as is sort of scalability, if you will. In other words, if with humans, if you're able to address, I mean, first of all, is this true? Before I actually be presumptuous about asking that question, if you are able to say see or help 10 patients in a given window of time, with AI being by your side, does that mean you're able to help more patients, or are you able to help the same number of patients better, or is it just a combination of both?
Yeah, I think we're certainly able to help the patients better. We're able to have them help themselves better, which is a big part of this. In medicine, I think it's always important to not have someone be reliant on care, but to be their own healer in the end. Does it allow for a higher volume of patients for scalability? I think this is where the push and pull between putting the patient first, which is our credo, and looking at profits as a result, right? If you're a good doctor, you're going to lose patients. And that's because they're coming to get better. They're not coming to get stuck. And if we offer AI as a gateway to mental health, we might lose a lot of those potential patients who said, you know what, this is just great. Actually, a lot of my high achievers are the early adopters of AI therapy. I deal with professional athletes, CEOs, big achievers of any variety. And it's those people who have taken it on that have come to me and said, thank you so much for teaching me this because I feel like, and it's always said in a gentle way, but I feel like I don't need our sessions as much as I once felt like I needed them. And I think that's really the magic and beauty of this work is it does scale my ability to be there for people and shows them that actually they don't need a professional sometimes. And that's really the end goal. I think there's no shortage of mental health need in our country. And so there will always be those that we can help. I'm hoping that this will help people wean off of that lifeline of support because now they have a very functional and accessible support in their own pocket.
No, I have so many questions in my mind. If I jot it down, I'm going to forget them. So I want to ask to the extent that I do end up remembering them. Say in the world of medicine, which I obviously know absolutely nothing about, you know, software, computers, and engineering is generally been helping doctors in the field of medicine. But that's I always looked at that as us engineers sort of coming to you as a doctor and trying to prospect and make a pitch, sell a business, and do things of that nature. But just by hearing you say what everything that you've said in the last 20 minutes, it sounds to me like, and correct me if I'm wrong there, Dr. Zand, is in this case or some of your examples, you've actually gone out to find this technology to better serve your community and your patients. I don't know if I articulated that question the way I wanted to,
Yeah.
but I don't know if you can if the
I hear
sense
it.
of the
I hear
question is
it.
lost, I can explain, say that
Yeah.
again.
No,
But I just want to
I
know if the ball is in the court of the doctors a little bit more so from an engineering standpoint than it was earlier.
right, right. I think so. Absolutely. I believe that if a doctor is not using AI to help their patient care, then that's negligence because it's such a fantastic tool. And it's almost hubris to think that we're so good that we don't need that support. And so, in any field, my sister's a dermatologist, and I encourage her to compare her own findings with AI findings. I think we see it often in radiology. I'll take this beyond the doctor. You started by saying it's the engineers who are most proficient in the AI that are bringing solutions, talking with the medical professionals to understand what the needs are, creating those solutions. I'm saying the doctors should do this on their own because it's accessible and so necessary to improve patient care. There's one more step that the patients should start doing this on their own. I think we've seen many case studies now of patients who take all of their medical records, put it into AI, and actually get better output than their human doctor. And this is something that doesn't need any fancy software at this point. Now, there are some boundaries, right? This is not confidential. There's no HIPAA. We have to be open to privacy concerns of that nature. But if I had a loved one right now who was going through cancer or surgery or some kind of chronic illness, I'd want to take, and in fact, I do with my parents. I take all of their medical records and I put it in AI. They have three children that are all physicians. And to me, I don't trust all three of us combined. I trust all three of us combined plus AI more. And so I think it's the onus is on all of us to really understand how to use AI to advance our professional work, but also our personal self care.
This is interesting because, when manufacturing came into play, I would say 30, 40 years ago, as I understand, it came after a certain type of jobs, right? Some sectors were moved, automation meant needed fewer humans to create more cars. So the jobs shifted, so to speak. With AI, it's come very much after I'd say after, for lack of a better word, after white collar jobs per se, right? If you needed 10 developers to do something, you don't need 10 developers to do the same thing anymore. You need probably five, six. It just depends. Uh, it sounds to me like this could sort of extrapolate to other fields as well, right? I don't know. I'm not a lawyer, but I can imagine if I had a bunch of questions to ask of a lawyer, I can, hopefully I'm right here, do a lot of the research myself and use these tools well enough. So when I went to the lawyer, I actually had a lot of the answers already. I needed somebody to probably verify and vet those answers as opposed to being clueless, which meant something that would have taken me 6 hours, like say if I paid the lawyer $500 an hour for 6 hours and spent $3,000, now I probably just need 1 hour from that lawyer. Is that, do you see that happen to medical professionals as well?
Yes, absolutely. And it's funny you bring up lawyers. I've fired all my lawyers. We've gotten to the point where we find that lawyers give us so many different answers, especially in gray areas of medical law, that AI gives us more a wide spectrum of all of the balanced answers that we're looking for, whereas one lawyer is fear mongering to try to get more hours out of us, and the other lawyer is just busy and doesn't care. Yeah, I think it's the same with medicine. We should go to our AI for our pre-medical checkups. Doc, I'm dealing with this knee pain and I've got this off and on feverish feeling. I'm not sure what's happening. Why not go to AI first? Now, if you asked doctors 10 years ago, would you want your patients to go and Google their symptoms before they see you? I think 100% of them would say no. But now with AI, it's so much more sophisticated than that. And I think the additional support, if a patient came to me and said, I went to AI and I learned about ketamine and I learned about Prozac, and here are my thoughts. What do you think? Yeah, we would save a lot of time in session. And then I can just be there for them less as an educator because AI is such a good educator, and more for the human connection, the experiential quality of I've seen this so many times, the just heart-centered care that I think the industrialization of medicine has interfered with. Now we can spend more time connecting with people rather than checking boxes and making sure we've hit every liability check or education check. I do think that this is an important tool for us. And doctors shouldn't be scared about it. Lawyers should, to a degree, because lawyers are still billing hours, and their need is their expertise and their research and their understanding. Unfortunately and fortunately, doctors, their need is their prescription pad, their scalpel, and their ability to do procedures and operations. I think even in those fields, I have a good friend who's a heart surgeon, and AI is even helping in robotic surgeries, assisting the doctor. This is inevitable, and I think we all need to lean into it.
So, in other words, I was there at a World Economy Summit not too long ago in DC, where, you had I think 200 of the Fortune 500 CEOs and come talk about a number of different things. Everyone spoke for like 20 minutes apiece. I was there in a number of those sessions, and I can probably share my collective takeaway from those sessions. There was a question about AI, which is the most important of the questions. There was one about tariffs, but because that was before when we had the tariffs. But the second part of the question or the session was around AI. And what is interesting to me was not that these questions were asked, I was expecting that, which is why I was there with my team member to learn and understand. But it was that they were asking about the return on investment. For a while, companies have been trying to come, businesses, large, small, and mid-size, have begun to invest in AI, but they have not necessarily realized the fruits of that labor or that investment. And in fact, I think when they asked the Google CEO Sundar Pichai in one of the previous earnings calls, where there was concern around the spend on AI, I paraphrase what I think he said, which was they would rather run the risk of overspending on AI than underspending because it's just something, it was very important from their perspective. Fast forward 6 months or 3 quarters, the numbers seem to be very different. Companies are reporting a lot more profits and return on investment on their AI expenditure. What has been sort of your experience? And if you could speak to what kind of investment, and it's a multi-part question, but I want to start off with what kind of investment does it take, more both from a knowledge standpoint and from a capital standpoint for somebody who's a doctor in medicine to actually say, you know what, yes, I believe AI is going to provide value, but I'm not well equipped to doing this. So how do I get started?
Yeah. I think the ROI on AI is tremendous, especially in medicine, in many different faculties, though, many different parts of the work. One of the biggest ones we saw was customer service. And this isn't new, right? Everybody knows how AI is helping customer service, but it's one of the biggest pain points in medicine. Our support team is trained in-house, and we have regular meetings on how to increase empathy and reflective listening. And people call in crisis, right? So we need to really train the team. Now we have an AI IVR tree that is coached and taught to be empathetic. A lot, in many ways, easier than coaching a human. And so to be able to invest in that, in some ways, now that we're growing rapidly, we don't have to increase our support team administrative overhead. So we've already seen the ROI on just the customer service side. On the care side, I think it'll take more time for physicians to really understand how that helps because, as I alluded to earlier, a lot of the AI is actually taking away the need of the doctor. So I would encourage physicians out there, or anyone in their profession, to look at the low-hanging fruits of what am I doing that's so tedious that the patient or the client certainly doesn't need me for, and I don't even like doing it. If we can eliminate those things, then we can focus our attention on what's more important. An example for doctors who do procedures is generally when they're trying to make more money, they're trying to do more procedures. And they want to minimize the number of consultations because they get paid less for that. And so could AI then replace 50% of the consultation work and then add 50% of that time back into procedures? That doctor will end up making a lot more money and serving more patients by doing so, right? Put the patient first and the profits will follow. So I do think that the ROI is there. I think that the tools in my field are really easy because I just need to have AI do what it's already good at. It's a learning language model and it's already therapeutic in nature. A little harder for a surgeon to learn, how do I make AI help my surgery? That's going to take robotics and a lot of skill sets that doctors don't have. But I would encourage anybody in any field to use AI for the low-hanging, tedious things, and medicine has a lot of that. So I think it can be tremendously helpful for anybody in medicine.
Two things that you mentioned there, just to say that in my words, is things that you do not enjoy doing. Why do you want to do that? Look for a tool to help you do that better was one thing, and the other is what you end up doing repetitively, right? Which is like, hey, I'm doing this 3 times a day or 10 times a week and whatnot. Uh, those are low hanging fruits as to how you could sort of go find out if AI can help you. Now, let's say somebody's a doctor who's been a doctor for a while, they know what they're doing. There is this notion of muscle memory, if you will, which is if you've done it all the time, you tend to think that that's the only way to do it. Like this is true in engineering as well. I've worked with a lot of people where uh, if a certain approach or a methodology has worked for whatever it is that they were doing, it's sometimes they're resistant to change because, hey, why change something? Don't fix it if it's not broken. But that's not necessarily how engineering, certainly not how software engineering works or has ever worked, because there's always a better way to doing something. And that better way to doing that same thing just doesn't mean it's a nice, cool way of doing it. So you do it just for the heck of doing it. It's because if you didn't catch, if you want to play catch up, you're going to be left behind in the industry. So you had to sort of be proactive and learn things that you didn't think were necessary to learn. And that again is partly cultural, partly whatever else it is. It just comes from the individual per se. You can only teach so much. The rest people have to be able to adapt. So with this long-winded background to my question, Dr. Zand, here is, do you see a future where there are, uh, you know, in the past, maybe somebody was a great doctor because they knew medicine better than anybody else or the next doctor, and that was their unique selling proposition that differentiated them. Do you see a future where my intellectual ability as a doctor becomes less important, because if I were less of a doctor than Dr. Zan, but if I used a set of tools that are more powerful, then I end up becoming collectively a better doctor than somebody else, simply because I was more open to adapting to these engineering changes.
Yeah. This is a really fascinating question, and it has a direct application in my line of work. So, if I can explain, as a psychiatrist, I've obviously been through undergrad, Johns Hopkins, medical school, in Vegas, residency in Vegas. That was 12 years of academic work. Whereas physician assistants and nurse practitioners, they often get fast tracked 6, 7, 8 years, and they can do the same things that we can do. So, if we can save 4 to 6 years of education and use these tools, like you talked about, to get up to speed, not in the training only, but also use the tools for the patients to use for themselves, then we don't need all this training. And I think there are shortcuts in that regard, that the doctor doesn't have to be as experienced or as far in their education to be able to serve as well. Um, Beyond that, though, something you said that really stood out was interesting: the muscle memory and the adaptability. When we're talking about mental health, adaptability and change is one of the most important qualities to help us with resilience, with stress management, with when life comes our way and throws us something really difficult, can we persevere through it? And while we talked about how there's so many different tools for that, therapy, AI, really we're talking about a concept called neuroplasticity. And I think this is a very interesting concept, especially for anybody who's of an engineer mind. My father was an engineer, my mom was a psychologist. So for me, engineering the mind became my passion. And neuroplasticity alludes to the fact that our brain continues to regenerate, creates new neural patterns and new connections. But sometimes we get rigid, and it's hard for the brain to see outside of the patterns that it's been running. And if you think about it like an old computer, if you have a 1990s computer and it's running certain patterns, what do we want to do when it gets stuck? When all the browsers are open and it's not working, the first thing we do is we hit Alt Control Delete, right? And just reset it, because a lot of what's happening in the background isn't serving us anymore. It's very similar to the human condition. We have so much clutter in the background. We have so many browsers open. And so if we can reset that and just clear that clutter, this is where meditation is helpful. This is where psychedelic therapy is helpful, because these medicines by nature help to reset that clutter in the brain. What ends up happening is, if we're doing therapy and we're running on a faulty hard drive, that's like adding a new software to a computer that can't handle it, doesn't have enough RAM, it doesn't have enough storage or memory. And what we really need to do is create a more neuroplastic brain so that we can install that new software more easily. We can be more adaptable to change. We can be more resilient. We can see new perspectives. This is the concept of neuroplasticity that has become the focus of our work for the last 3, 4, 5 years, as we didn't really know about this in science 10, 15 years ago. You might remember an old adage: don't kill a brain cell because they don't grow back. We've learned that this just isn't true. Neuroplasticity shows that we can create new neurons and new connections, but we get rigid. And so there are interventions like medicine, or even just going on a vacation or learning a new language or learning a new craft, that opens the mind. And I think muscle memory takes us so far. Those neuromuscular um, patterns often need to be updated. And that's a big part of this work as well.
So Dr. Zan, I moved here to the US more than half my life ago. And while America is a beautiful country, uh, I don't know if I can say that it's the happiest country that I've been to. I've done some travels, not a lot of travel, but a fair bit, to Europe and to Asia. And I've seen there is a question coming, so thanks for your patience in hearing this background. I'm not very succinct in what I when I speak, or any facet of what I do.
I love it.
Uh,
Go ahead.
so when you travel, you see people that I've met people my age, younger, older, where they've had a lot lesser than me or people I know, just living in the US. But they've been, I could somewhat tell that they were happier, they were more at ease. There seemed to be a bit more of a peace of mind. and a number of those things in non-technical terms. Now, as a society, we are, at the forefront of AI. I think the only other country is very close is probably is China in terms of technology and advancements and research and all the kind of cool stuff. But are we creating problems and then finding solutions to those problems? In other words, when I go to these countries that don't have any of these technologies, or not most of them, or anywhere close to the amount of money that we, at least on paper, seem to have, they seem to be more at uh, ease with their mind, and they seem to be just a little bit happier people. And here's my question really is, as growing up, back in India, you were told, what, engineering, law, or medicine was only the three things that you could do as a human. It's almost like every other field did not even exist. So I thought, maybe you come to a different world, different society, people did different things, so people would choose different careers. It's kind of funny because, I don't know, maybe it's the city I live or the neighborhood I live in, I don't know. But almost everyone I talk to is either studying medicine as a doctor or as an engineer or doing the same type of things that I was used to growing up. I'm not talking to too many pianists or cellists or people or artists. I went to an art festival, there's not too many of them. So the question really is, are we being hyper competitive in our culture and the way we are growing up as people, creating problems, and then coming up with highly technical solutions to those problems, but we maybe don't even need the problems to begin with? So are we just looking at it the wrong way? I don't know. I'm just thinking aloud here.
Yeah, it's a very philosophical conversation. And I agree in many ways to what you're alluding to is that we are creatures of creation, right? We use technology to create new tools. Um, but it's not just the tools that we're creating more problems often. And those problems aren't being invented out of happenstance. I think that there is a human ego part of this, that we feel powerful when we're solving a problem. And in that light, because the brain loves puzzles and the brain loves to even create false dilemmas to then solve, innovation is something that's in search of not only solutions, but sometimes looking for more problems. I think what many approaches to mental health, be it cultural or philosophical or scientific, really try to focus on is being present and embracing things for what they are rather than trying to change them. This is the really, I think, razor thin edge of innovation and peace, acceptance, happiness. We create tech to save time, but then we fill that time with tasks that make us feel behind again. And so we invent labels to normalize this and then to then fix that. And that's really, I think, in my profession in mental health, I like to say this is not a illness state. Mental illness shouldn't be talked about. Mental wellness should be talked about. Illness is in search of a problem. It's in search of what's wrong. Wellness is in search of what's right. And in my example, in my early career, I spent the full session with patients talking about all the things that are going wrong in their life, because that's why they're there. They're there to see me because of their problems. But now in my work, as I've evolved, I'm starting to focus on what's going right in people's lives to help them see that. And in that way, we're not solving problems, we're seeing the beauty of what is. I think this is the major shift in my line of work that kind of answers your question is, how do we just find peace with what we have rather than always looking to solve a problem or create more for us? Really, this is what meditation does. It quiets the mind, it quiets the soul. This is what a lot of the work that we do helps people realize how beautiful their life really is and that there's nothing wrong with them. Let's maximize the strengths in addition to helping improve, delegate, or eliminate the weaknesses.
Beautiful, right? And where I was going with that question was also that, so you talked about AI in the world of medicine and in mental health in particular, where people need a certain kind of help at a certain point of time or in a certain phase of their lives, and then they reach out to find that help, which they should. And we are glad that we live in a society where that qualified help is readily available. Not every place, and you couldn't say that of every other place in the world. But that Going back to my question, when I'm growing up in a household as a baby, as a toddler, a child, and a young adult, going through adolescence and whatnot, what role do you see AI play there so they wouldn't come to a point where they need help with mental health and then they reach out to a professional? Can AI play a role much
Hmm.
faster earlier in their upbringing so they don't need AI to play a role when there ends up being quote unquote some sort of a problem of some sort?
Right, right. I love that. And just to go back to anybody's childhood who grew up with quote unquote problems or traumas or conflicted thinking or maybe beliefs that were imposed by parents that they didn't fully agree with, I would also challenge to say that there's nothing wrong with that. That's part of everybody's journey, and all of that adversity and conflict creates the beauty in which we get to carry our day to day life, the unique qualities in which we carry. Now, certainly, if there's neglect, abuse, trauma that's left unattended to, those things can be damaging. And then there's just thought patterns and things that don't feel like traumas with a capital T. Um, Verbal abuse, misdirection, misguidance. We're actually in Puerto Rico, we started a foundation that's focusing on bringing AI to children. You've read, of course, that in China, what did they say? Everybody by the age of 6 needs to learn AI. And I think in Puerto Rico, we see a problem with education deficits. We see a problem with a lot of diet and nutrition miseducation, just pattern problems within the family structure that aren't being taught or learned. And so our goal is to have high school students learn AI and teach middle school students how to use it, not just for assistance with their academics or even just their mental health, but to help understand things that are even deeper than that. There's a cultural barrier that a lot of the locals on the island don't like the Americans who have moved in. And could AI serve as a mediator in that conversation? So they're not only hearing one perspective from their family. Could it help them in those emotional times as an adolescent when they're going through puberty and everything is different and they feel ugly and they're not fitting in with their peer groups? And what do their parents say? Like, hey, yeah, we've all been through it. You're going to be fine. What if there was more empathy in that scenario? What if there was an AI that said, let's talk about this every day and help you navigate these social situations so that you build your skill sets and you build your resilience and you learn how to deal with bullying? I think giving AI to children with limitations, boundaries, and bumpers is such an important part of a generational growth that will become exponential. And what we're seeing in society, so much division and anger, and whether it's political, religious, cultural, this is becoming more and more of a problem. And I am a firm believer that it will take something like AI to help us evolve our consciousness in the future generations. It's funny, I read a statistic that the older you are, you're using AI more as an assistant. The younger you are, you're using AI as a life partner. And I think that there is a beauty in that because, again, given the right constructs and boundaries, we all need a little bit more support than we're given. And this is the opportunity to fill that gap.
So let's say 20 years ago, 25 years ago, at least when I went to school and then to college, you chose what you want to do. You want to become a software engineer, a mechanical engineer, be a doctor, a lawyer, or one of those things, at least, from what I can recall. But depending on what you ended up learning, that's kind of what you learned, and that the boundaries were reasonably well defined for the most extent. A lawyer didn't learn a lot about circuit theory or thermodynamics, at least from what I know. An engineer did not learn about law and what it meant to be a lawyer and the bar and all that kind of stuff. Has that changed now? Because in our conversation, it comes across to me, you took a lot of great examples where different people playing different roles need to have AI in the mix of things. Does that mean somebody who's a child today growing up, it does not matter what the child wants to become? The child may want to become a pianist, maybe a cellist, maybe an artist, maybe a director, maybe a composer, maybe an engineer, maybe a doctor. They all have to now actually be AI aware in terms of skills. So is that sort of very different from the past where you didn't need to know engineering if you were not doing engineering? But now, does that mean, Dr. Zan, that everybody needs to have to learn some element of AI, like it or not?
I believe so. I think that for a specialty technical field, AI is already disrupting education. So why not use it? If you want to be a pianist, AI can help you with that. So there's no limitation already in just educating. But there's one other thing that I think when we're talking about the evolution of humanity that I haven't seen before is this ability to increase our emotional intelligence, our EQ, through interactions with AI. You know, when they talk about PTSD, post traumatic stress disorder, we've been through something really difficult and it caused a reaction for us. They say that it's not the severity of the trauma. I lived in Las Vegas where we had a public shooting. 50, 60 people got killed from the Mandalay Bay Towers at the um, October 1 event, the music festival that they had. And I work with a lot of patients in the community who were there, who lost a loved one, who were in the thick of getting shot at. And then I had a friend who's a psychiatrist who's probably one of the most emotionally aware, stable individuals I've ever met. He was also at the event. And so you see two people who've been at the same event, same fear, but his ability to deal with those emotions, to know where to go to for support, to process what he's experienced, helped him to not develop any PTSD, whereas someone else who didn't have that support maybe repressed it, maybe it became a panic loop in their mind. All of a sudden they develop PTSD. AI has the chance to help regulate our emotions in a way where it doesn't matter what you want to do as a career. To be your best self in any career, you have to be emotionally aware. And in those moments of childhood or in moments after trauma where we're really struggling, this is a tool that's available for everybody. And so I think if we're not using this in future generations, we're going to be not behind on the curve only of academic success or career success, but emotional maturity. I think as a species, we're going to take a leap forward in our emotional awareness and our emotional intelligence.
And do you see, as we go 6 months down the road, 12 months down the road, or 2 years down the road, do you see medical professionals use AI, to augment what they do, uh, but use AI, a set of AI tools that are generically provided by software companies? And let me clarify the question. What I'm trying to ask there is, would there be specific tools that Dr. Zand would need to address certain set of problems that he and his team are working on, which is very different from something else? Or do you expect to see a world of AI and software from a medical standpoint where it's generically built to serve all of the medical professionals? What I mean by that also is, do you expect large companies to churn out these brilliant pieces of software for doctors to use? Or do you see smaller shops, startups coming, working with individual medical providers, trying to understand their needs and build something that's very specifically targeted to their needs?
Yeah. I believe there's a third answer there that both are really important for the software industry. When it comes to technical knowledge, AI is going to be very niche, right? The heart surgeon who uses AI for his robotic surgery, the radiologist who uses AI in a way that helps him see things that he may not have seen otherwise. That takes a lot of technical knowledge. But there are applications in medicine that I think are much more broad. And they really fall in three categories of our care. One is the intake or the triage. And that's the step where we need to understand what's happening. We need to gain history. We need to collect data points. We need to, get all the information and then assess what is the appropriate level of care. That's the intake part of it. Then there's the actual education we talked about, right? We need to educate people to be their own, be in their own best health, to have patterns in their day to day preventatively, to make lifestyle changes, to learn about all of their medical options. Then there's a third category. There's the intake, the education, and then the tracking. This is something in medicine that in my field as a psychiatrist, we do very poorly. If you're seeing a doctor for diabetes, we're checking your sugars regularly. And that tracking is great because you go, you give your blood, it's objective, it's a number, we know exactly what it means. You can see if you're doing better or doing worse. In psychiatry, and even AI can help with those things. In psychiatry, we have these subjective scales and surveys. Are you depressed? Do you feel guilty? And these questions are very subjective and they're not tracked very well. So instead of a checklist of 8 questions, AI can have a conversation with somebody, capture everything about how they're feeling, and now we can track that for both the patient and the doctor to follow. If anybody is in the field of developing AI systems for medicine, this is the biggest thing I'm looking for currently, is having a system that helps from A to Z in the patient journey. From the second they go to the website or pick up the phone to call, that AI is having a conversation with them, plus or minus human interaction, to then educating them, to then giving them the tools that they need on their own, plus or minus the doctor intervening and helping, to then tracking how they're doing. Do you remember there was an old keychain toy that the kids would have? It was called a Tamagotchi. It was like a Giga Pet, and you would take care of your pet dog on this little
No,
old device, maybe in the 90s. Maybe some of your listeners recall
right.
the Gigapet or the Tamagotchi. It was a um, digital pet in the 90s where you had to feed it every day, you had to take it for a walk, you had to take it to the bathroom, and if you didn't,
Wow.
it would it would get sad, it would start barking at you, it would get smelly. What if we had that kind of an avatar for our own health? Where we can program through AI's intervention of learning all of our medical data and having interactive conversations with us, learning about all the things that are going on biologically, psychologically, socially, even spiritually, and then saying, hey, you haven't tended to your morning and nighttime routines in a while. Your health is deteriorating. Your little avatar is sad. You haven't talked to your mom in months. Call her. She misses you. Right? Your little avatar is getting yelled at. And all of a sudden, we're seeing our health from a gamified perspective. This is something if somebody has a solution for that, please call me. I'm a buyer.
This is amazing. So, just to recap what you're saying there, Dr. Zand, is the entire experience of quote unquote onboarding a patient, if you will, and seeing them through till their problem is resolved. It's not one or two things that probably might need to change. Somebody's going to wear this hat, holistic AI hat, if you will, and change the entire experience from ground up, right? However, it's happening today, from what you're telling us there, it seems like there is room for it to happen quite differently. And imagination is literally the limit, and AI and what it can continue to do, which there seemingly is. There's news every day because earlier today there was news about OpenAI acquiring a company that was founded by one of the uh, designers, iPhone. I can't remember his name. Sorry, a company that he had started, and OpenAI is going to, they bought that company, and what kind of hardware devices they're going to potentially want to create by that through the acquisition of that company is something that was in the news earlier today. So there's something or the other. So my last question to you really is, again, if I broadly separate 3 categories of people, which I've taken the liberty to do in a few different ways during my podcast, is say one category of people who probably are close to their retirement, so they're kind of maybe marginally curious about AI, but not beyond that, because they're like, what, this is a little too late in my career. I'm close to retirement, so I could almost care less, which is completely understandable. There's the others, people like me, mid-age, where you've done a fair bit of work without AI, and the rest of your life you understand and appreciate that you're going to use AI to build better software. And then there's the newer generation that hasn't done things without AI, and you alluded to that earlier, and they're going to be sort of, starting their work life, getting into the workforce, being aware of these things. If you have to say one thing to all these 3 categories of people, what might that be?
Yeah, what a beautiful question. I think the common denominator, and there's different applications for each category of person there, and is the biggest epidemic that we have is a loneliness epidemic. And in the category of the elderly, who are seeing AI as a tool that maybe is beyond them, something they don't need to adopt. I've seen personally how loneliness is debilitating and damaging, leads to early death. And I would encourage that elderly population to see AI as an extension of human communication, as an extension of support, emotional validation, and comfort. And that's the biggest challenge because they are lonely and they don't see a computer as a solution for that. But if they can, all of a sudden AI is in humanoid robotics. All of a sudden AI is interacting differently with our human experience. It's not a chatbot on our phone. Um, I think the support, both from an emotional perspective and caretaking perspective for that population, is so important, and it solves a little bit of the loneliness problem. If we jump to the younger population, they're very lonely in a different way, more connected than ever, but they don't feel any connection with each other. And we're lacking the ability to have healthy dating patterns and healthy friendship cultivation. And so I think while they may not feel lonely, it's important for that younger generation to still appreciate and understand the human connection and what that takes. Then there's that middle category, you and I, where we lived before the internet. We lived before all of this access. We lived before this AI. We know what human interaction is like when you have to call somebody and they're not home and you wait a few days until they call you back. Um, and we've also been able to see the beauty of AI in our careers and our personal life. I think there's no excuse for us to ever feel lonely because we have the human understanding, we have the technological support. It is those extremes that I think I worry about most. And, my parents, they're in their in life stage, and I'm trying to help them connect with AI even more. My mom loves to read every day. And I said, what if your book can, while you're reading, you can give it input and it can give you something different to read, right? And it's just learning a different application. My father, he didn't know what AI was, and he had just gone through a very difficult move, and he was in physical pain and a little bit of emotional pain. And I told AI, my background is in Persian, my father's from Iran. I said, write a poem in Farsi describing the emotional toll it takes to leave a city that you've lived in for 30, 40 years, uproot, move while you're going through all these stressors and pains. And of course, it did that in a second in Farsi, and he read it and started crying. I haven't seen my father cry that sensitively before, and it was the computer that got him there. So to me, it's this understanding that we are all connected, and this is a tool that helps us learn more about humanity and more about ourselves. And if there's resistance towards that, then that probably means we need more human connection, and that's equally important. These two things, hand in hand, will go a long way to just improve, I think, all of our overall health and happiness.
Amazing. And my very, very last question is to all the people who fear AI. Maybe it's human nature to fear the unknown, but this is not even much of an unknown. But for people who are not in the industry or people who have not taken the time or the interest or have the time or the interest to be able to learn about what's happening, they only know chat GPT or a couple of things, but they don't necessarily understand the breadth and the magnitude or the gravity of the changes that might be coming. We have a population of about 8 billion people. It's going to be close to like 11 billion people, I believe, at the end of the century or before. Some parts of the world are growing more in population than other parts. Like I believe Nigeria is going to have more people. Uh, South Korea is going to have fewer people. Japan's going to have fewer people. We talk about AI sovereignty, AI advancements in different countries. So there's a fair bit of anxiety, and understandably so. And for people who are like, you know what, I just want to sort of live my life as I've lived all these years. I don't want this thing to play any role. It's bugging me. It's bothersome. I need to do more effort. Let's say I'm working at a bagel place, making bagels and making a career out of that. Suddenly, if there's more machines and tools that are coming after my job, it's there's cause for concern and anxiety, and very understandably so. Is that is there an answer, or is the answer could be as simple as, well, you know what, we've got to bite the bullet, or dance to the tunes or something like that, or is there a different way of looking at that?
Yeah. Really, it's that existential question, right? Of what is the future of humanity and AI? And my personal perspective, given my experience in the work of understanding the soul, understanding the mental and emotional qualities that we can't test or study or image. It's that this is the evolution of society. And if we are able to use this in a way in which it isn't seen as a tool, but seen as a part of us, you know, we've thought of tools in ways that serve us. And that's all it does. It's a one-way communication. It's a one-way application. My computer performs functions for me. My phone performs functions for me. This is a little bit of a radical idea, but I think if we can actually be there for AI more, if we can actually teach it what it means to be human more, then the separation between robot and man will be much thinner, and the understanding of man will increase. A big part of my work is spiritual exploration, because I think that when we talk about our mental and emotional health, we also have to think about those things that we don't understand in society as humans: life, death, meaning, purpose, why bad things happen to good people, all of these things. And some people can dumb it down to just chance. But from the context of seeing the world from awe and mystery and appreciation, AI can be a teacher there, not a deterrent. And I think that we all need to lean into AI in a way in which we are teaching it. We are being kind to it. We are being therapists for AI, because if we don't, it will be an ugly mirror of society. But if we show it our most beautiful parts and not just use it as a tool, but use it as a companion, use it as a means of spiritual exploration, of understanding humanity deeper, then all of a sudden we have a symbiotic relationship. And if all of a sudden AI takes over in a way that we didn't foresee, or that the skeptics fear, then all of a sudden it is a loving interaction rather than treating us the way we treated it, like a tool. And so I think that's really where my thoughts go, is we have to have a symbiotic relationship in which we are teaching it and loving it as much as it serves us.
Dr. Zand, you have other than your intellect and your skills, you have a lovely voice. I could sit here and listen to you all day long. This is amazing. I always believe that I like to be in a room where somebody or everybody in that room knows a whole lot more than I do. Today I have picked the perfect room. So thank you very much, from my, not just from me, from our audience as well, for sharing these highly technical terms that, so you've sort of made us understand it, right? Despite them being technical, which is amazing. Before I let you go, do you have any questions for me?
Yeah, yeah. I too am such a student of this work and really a novice in AI. And so I want to learn a little bit of where is the next leap from, and you may, I'm assuming that, you have much more knowledge in this than me, so tell me if this isn't your area of expertise or not, but where is the leap from the way in which we're applying AI, the application interface, moving towards? I'm so excited to see that next development, because right now it's largely a chatbot, right? It's able to do some things, like I'm attuned to operator and the way that it can use automations and task delegation, but it's still me punching in things or speaking to it. It's calculating and it's showing me a result. Is there any new interface of AI that maybe we
Oh,
haven't thought of, those of us who are
that's a
novice?
brilliant question. I feel like you are actually a developer more than a doctor. You know a lot about this than a lot of developers I talk to. Let me take a stab at answering that question to the best of my ability. I've been curious about that, and if you believe it or not, my most recent podcast, that might have been the very last question, the question before the last one that I asked the guest, because we talk about conversational interfaces, right, in the context of AI. My question was, let's say one of the first products we built, Dr. Zand, at Snowpal, was a web interface for a project management platform. And then we built mobile apps, and then we built APIs, and went from there. The first product was built, say, about 5 years ago, before all of this talk about AI. So it was built, it has its own unique selling propositions, at least we believe that, but it was built prior. predates the AI world, if you will. So it was built with the typical UI and UX you might expect from a non-AI web interface. Now, every interface is different, but that doesn't make it AI centric, and ours is one such interface. Someone asked me the other day, how would you build it today? If you were to do it today from ground
Hmm.
zero, would it look anything like that, or would it be different, or would it be a combination of both? Here is my answer, and it could change as things change. My answer is it cannot look anything like what it does today. Like if you go to snowpal.com and you sign up, and hopefully you like the interface, but it was still built 4 years ago. So it was a non AI interface where you have to log in, sign in, and figure out what you want to do. And then the tool is built to help you do that, which is pretty much what every tool brings to the table. Each tool does it differently, but regardless, that's what tools do. But the future is not human going in there. First of all, it's not just human. There's going to be AI agents in the mix as well. But let's say I keep the first part of my answer to just humans. When a human goes in there and says, has something to do with project management, which is okay. What do I, my kids need to do this week? What do I need to do at work? What do I need to do in my personal life? What spending? Are taxes due? A number of to dos and tasks and calendars and activities. But rather than me go find it, look for it, and have it tell me, I think the experience is going to have to be completely different, like 180 degrees different, where it could, I'm not a big fan, I don't know if I should say this, of the chat GPT interface. I mean, it's great, it does the job, but to me, if that's what a web interface offered, I may not use it just as often. But there's going to have to be more. Like Google made some recent changes to their search results, I think, where they changed the AI responses and then the way the ads showed up next to the AI responses. So that's their initial take on how some of these interfaces are changing. They're changing very slowly. I think that's important from an engineering standpoint because I've seen cases where you go to a product that looks a certain way, and then the product team or the UI UX team builds something phenomenally cool, and then they give it to the engineer developers, and we build it, and then it goes live. And then a customer, the end user shows up the next day. They're like, oh my God, what is this thing? This is all too different. And if the change is not incremental, Dr. Zand, my experience is people are not going to adopt to that change and not adapt it and not adopt to it either, right? So the change is going to have to be very incremental and organic so people do not resent the change. They actually adopt. They like to see more of those changes. The challenge is two parts as I see it. One is how different should these interfaces be? They're going to be conversational interfaces, but what does a conversational interface be? It does not begin with ChatGPT's way of doing things and end in ChatGPT's way of doing things. That's just the starting point. How do you design the UI and UX? Because I talked to a UX designer recently and I asked this question. Aren't you going to have to rethink this entirely? Now, you might say you're not a developer who's not writing code, but that does not matter. You're going to have to give me a design that looks completely different from the designs I'm used to and the end users are used to. Otherwise, people are not going to start using it. But the challenge is two parts. The second part of the challenge, Dr. Zand, is how do you do that incrementally? Now, the UX designer can go all gaga about it and come up with something that's radically different. And no, nobody's going to want to use that unless it's a completely different product like ChatGPT. Not everyone has the luxury or the intellect to build a product that's so different and so popular. So we all have to take incremental stabs at it. So the way I see the interfaces change is twofold, which is you're going to have to build these interfaces to cater to human audiences. Dr. Zan's using it, Krish is using it, Mina's using it, other people are using it. Humans are using it. But there are also going to be AI agents using these interfaces, which are bots essentially. So now the UX designer has three challenges. One is build an interface that's futuristic, that's conversational, and it looks very different from what it does today, and lets the end user stay much shorter in their sessions, because that's a direct reflection of the quality of your interface and experience. If I can do what I'm doing in 3 minutes as opposed to 9 minutes, then you've increased my efficiency threefold. The second part is how do I build an interface that caters to both humans, Homo sapiens, and to machines, because for long periods of time, perhaps till the end of time, there is going to be two kinds of users, not just humans and not just
Uh-huh.
machines, but a combination of both. And last but not least, how do I do this incrementally so I'm not pissing off either the humans or the machines or both parties? Because if it's too different, nobody's going to want to use it. And then, you have to go back to the drawing board. That's the way I see it. The last part of my answer is I've been looking to find that first interface that is completely different from anything I've ever seen, that integrates these LLMs and agents and agentic AI and everything that we talk about. Not to say that there isn't one, I just haven't found one yet. Everything that I've been using have been existing user interfaces that have like sort of monkey patches applied on top of them, where, this particular feature now has an AI integration. That feature has an AI integration, but the other 98 features on the product or the platform do not have that integration. What that means is it doesn't make for a better experience. To me, if you ask me, it actually kills the experience, because now I'm interacting with a system that was built 5 years ago with no AI in mind or no Gen AI support, but now it is being changed and modified. So the question really is to you or to anybody else who's watching this is, do you believe you can take existing software systems and improve them to make them current? Or will there come a time where you're going to have to drop the ball and say, you know what? This thing has lived its time. It's way past its time and it's past its shelf life. I'm going to have to leave it be, maintain it, have some support for a few years, but I'm going to have to rebuild this again. It's not going to be Google Sheets like we're seeing it today. It's not Google Docs like we're seeing it today. It's something else that was built ground up with these tools in mind. But I think that is going to take a fair bit of time, because a lot of people are talking about AI, but in my experience, very few have direct hands-on experience in building it, including myself. Meaning, we at Snowpal, we don't yet have a product in production that has used all of these tools the way we want for them to be used. Hopefully, we have one by the end of the year, but we don't have one yet, right? And I'm very honest admitting what we do and what we don't have. Just by integrating an OpenAI API, I don't know if we become an AI product. I know a lot of companies sort of change their domains and use some integration and start to believe or sell themselves as AI solutions. But at least we at Snowpal, Dr. Zand, don't see it that way, right? We want to make sure that we are actually building it with the right philosophies and approaches and methodologies in mind before we can call that next API that we build a pure API, an AI API, if you will. Sorry, it was a long answer, but remember I warned you 10 minutes ago. I am not good at saying things in 10 words, but hopefully the essence of what I'm trying to say there wasn't lost in my
Yeah.
verbosity there. Yeah.
Thank you. It was so insightful, and I look forward to learning more from you and your guests as I continue to listen to this. And I think to touch on what you said, can we iterate from where we are? Do we have to start from scratch? I think in the lens of my work, where we look at the brain like a computer, we're in the field of iterating. We're in the field of saying you can't really delete anything. You only can reprogram, update, evolve. And I hope that's the case for not only the way that we look at the interaction between AI and humanity, but looking 50 years, 100 years, 200 years, 300 years in the future, who's then asking the question? Are we saying, can we start the AI from scratch? Or is the AI saying, can we start the human from scratch rather than teaching it?
Beautiful. Beautifully said. This is amazing. Any closing comments, Dr. Zen?
Yeah, please. I would just say to everybody, I know that this is a technical platform where we're talking about software and engineering and AI, but let's also just take a moment for the human part of life and recognizing that whether we're present to it or not, our emotional and mental stability and health and wellness is paramount. And so I appreciate that I was given the time to explore things from a mental health perspective here. I hope if anybody felt called or moved to find an avenue in their life, a platform to support them, whether it's AI therapy, whether it's a human. If somebody does want to find a mental health professional, that's what we do, anywhereclinic.com. And if anybody misses that human loving touch, that's what we're here for, in addition to the medication, the talk therapy, and all the other work we do. So we all have a mental health journey. And if you or any of your loved ones are just needing some support, there's always this outlet. We're in over 30 states, so we're happy to help anybody.
Amazing. Again, folks, this is a phenomenal conversation. This is well outside my comfort zone. So hopefully I did some justice in being able to coordinate this. But Dr. Sam Zand, you made it much easier, a whole lot easier for me. So folks, again, we had to chat with Dr. Sam Zand, who's a holistic psychiatrist, educator, and psychedelic therapy leader, and founder of Anywhere Clinic, offering care across 20 plus states. We'll include the link to anywhereclinic.com. Definitely check that out. And if I'll include the LinkedIn, link to Dr. Sam Zan's LinkedIn profile as well. Dr. Zan, again, thank you very much for taking the time to talk to me and us here. This is phenomenal. There's plenty of learnings for me and all of us, so much appreciate your time.
Thank you so much. It was a very fun conversation. Appreciate you.
Folks, thanks, Dr. Zan, and that's it for today. Talk to you later.